Hi, my name is Nora Giese and I want to warmly welcome you to this course about the treatment of endometriosis-related pain and its treatment with Chinese medicine. I hope you will enjoy this course and I hope you will learn a lot about the treatment of endometriosis for the best of your practices and of course for the best of your patients who really needs it. The aim of this course is to give you confidence in the treatment of endometriosis or the treatment of endometriosis-related pain. Because if you are already treating women with endometriosis, you already know that it is a very complex condition. And you already know that their endometriosis is causing various problems which need to address differently. So this course is focusing on the treatment of endometriosis-related pain and not, for example, endometriosis and infertility. So I want you to be confident in the treatment of endometriosis-related pain, and I want you to be able to specialize in the treatment of women with endometriosis. Therefore, we will talk about all the basics in conventional medicine. We will talk about the understanding of endometriosis in Chinese medicine. And of course, we will talk about the treatment details with acupuncture and Chinese herbal medicine. This course will also include recommendations for your patients, recommendations mainly about diet and lifestyle. And at the very end, we will have a step-by-step guide which will help you to implement theory into practice. Before we start, I want to quickly introduce myself. My name, as I said before, my name is Nora Giese, and I have a master's degree in advanced oriental medicine, research and practice, which I made at the Northern College of Acupuncture in York, UK, and at the Middlesex University, London. For my master's degree, I researched about the treatment of endometriosis-related pain with acupuncture. So part of this course will be based on my research, but of course we will hear much more than what I researched about. In my clinical practice in Bonn, I specialized on gynecological diseases and infertility. I'm a FABOR, meaning a fellow of the American Board of Oriental Reproductive Medicine. If you don't know the ABOM, it's an organization which ensures quality in the treatment of gynecological diseases and infertility. It's an American organization with members worldwide. So if you don't know it yet, get to know it. It's a good one. I'm lecturing Chinese medicine at the University of Witten-Herdecke and others. I'm a speaker on international congresses and conferences, and since 2015, the Fertility Day of the TCM Congress in Rothenburg runs under my guidance. In 2018, I wrote a patient's guide about endometriosis. Unfortunately, most of you won't be able to read it because it's in the German language. So you see, endometriosis is really one of my favorite conditions, or the one which I researched most about it. What will we talk about today? First of all, we will start with the numbers and facts about endometriosis, including the symptoms. Then we have mainly 4 parts. The first part is about the understanding of endometriosis in conventional medicine. This includes the treatment options in conventional medicine, as well as the problems and limitations which are arising from these treatment options in conventional medicine. Then we will talk about how Chinese medicine or how endometriosis can be interpreted in Chinese medicine. We will start with the current research, and then we will talk about the treatment strategies. And of course, as the centerpiece of this course, we will talk about the therapy with acupuncture and Chinese herbal medicine. As I mentioned before, we will also talk about the recommendations which you really need to discuss with your patients regarding diet and lifestyle. And in the end, we will have this step-by-step guide, which I mentioned before. So let's get started. The numbers and facts about endometriosis. Endometriosis is the second most common gynecological disease of women in their reproductive years. Endometriosis has a prevalence of 4 to 12%. This depends on different sources. And it affects about 89 million women worldwide. So it's really a huge problem. The most frequently reported symptom of endometriosis is pain, but the second problem, which is really huge and which I see very often in my clinic, is a significant reduction of fertility. Endometriosis causes also a significant reduction of quality of life, and the reduction in quality of life mainly depends on the pain symptoms. So this is something we address when we treat the pain symptoms of endometriosis. We treat in the same moment, we try to improve the quality of life of these women. Endometriosis has a cost side, which is causing annual cost per woman about 10,000 euro in the developed countries. So as practitioners, we don't care so much about these costs. However, this is something I dream about in the future, because I think or experienced, and we know that we can offer a lot to women with endometriosis with Chinese medicine, and compared to these really huge costs per woman, actually Chinese medicine is a cheap option. And it would be really great if this would change one day, and patients would be, the insurances would cover these treatment costs with Chinese medicine. Maybe one day we will have this. At the moment, usually the women needs to pay it themselves. Endometriosis is a chronic incurable disease. This is very important to know, because we need to be aware that we cannot cure endometriosis. This is something we need to discuss with our patients, and it is important which treatment options are the best for the individual patient. We will talk about this in more detail later on. So any treatment either aims at reducing pain, relieving symptoms, or improving the chances of pregnancy. This concerns both conventional medicine as well as Chinese medicine. As I said before, the main symptom of endometriosis is pain. There are different kinds of pain. 100% of women who are diagnosed with endometriosis report uterine cramping. Most of the affected women talk about cyclical pain and dysmenorrhea, or chronic pelvic pain, meaning the pelvic pain is not only occurring before menstruation, but throughout the whole menstrual cycle. About half of the patients also report dyspareunia, meaning pain symptoms during sexual intercourse. 39% talk about non-cyclical pain. A lot of patients, about 1/3, talk about radiating pain in the lower back and in the legs, and 28% have these pain symptoms in a way that they are incapacitating, so meaning that they are not able to work anymore, that they are really for 1, 2, 3 days only laying in bed, wishing that this time will pass. So this is really a huge burden, and well, as I said before, we as practitioners for Chinese medicine, we can offer them a lot. The second huge problem caused by endometriosis is the reduction of fertility. So this reduction of fertility is up to 50%. In the group of infertile women, which have been diagnosed with endometriosis, the prevalence is even higher. It's 20 to 71%, depending on different sources. One study showed that endometriosis has been found in 80% of women who were undergoing a laparoscopy in the context of infertility. So this is something you should, as practitioners, you should keep in mind, because as we will hear later on, the time until the first symptoms occur, until the women are diagnosed with endometriosis is up to 10 years. So this is a huge long time, and you will have a lot of patients in your clinic where you think they might have endometriosis, but they are not diagnosed yet. So you need to think about what you can do with them. Usually the first step will be to get a diagnosis of endometriosis. We will talk about that later, what the patients should actually do to get this diagnosis. The main point here is that you need to be aware that really 20 to 70% of your infertile patients may have endometriosis. So this is really a huge number, and this is something of course, this course is not about infertility. We'll have another course about this topic, but this is something you really should keep in mind, as a laparoscopy might help these women a lot. Of course, the reduction of fertility depends on the different stages of endometriosis, and we will also discuss or talk about the different stages later on. Further symptoms caused by endometriosis are bleeding disorders. This mainly concerns heavy bleeding. From my experience, a lot of women have shorter cycles, which make the problem even worse, as a shorter cycle is of course leading to more days which where the women have problems due to endometriosis. There are a lot of women complain about cyclical intestinal problems, especially bloating, diarrhea, constipation, dyspepsia, or constipation and diarrhea. A lot of patients also talk about fatigue symptoms, mainly before the beginning of the menstrual bleeding. But, and this is really essential, there are also patients with endometriosis which are asymptomatic, and so meaning they don't have any either they don't have any symptoms, or they have symptoms which you cannot directly link to endometriosis. So this is why endometriosis is called the chameleon of the diseases in conventional medicine, because it has so many different aspects, and the women show so many different signs which you cannot directly link to endometriosis. So this is sometimes it is really difficult to suspect if a woman has endometriosis, and what we will hear later on, it is not that easy to diagnose it. The main thing is that if a woman is asymptomatic, it is not necessary that she gets treated. However, I would recommend, if it is a young woman and she has the diagnosis of endometriosis has shown up by coincidence because she had a laparoscopy or an operation due to another reason. She just knows that she has endometriosis, and if it's a young woman, I think you should also talk about the recommendations regarding diet and lifestyle, which I will talk later on, because endometriosis is an immunological problem, and it makes sense that the women try to avoid everything which may increase the immune system, the activity of the immune system. So of course, they do not have to undergo hormonal treatment if they are asymptomatic. They do not have to go to do Chinese medicine, but you should discuss these recommendations regarding diet and lifestyle, and you should also discuss the further symptoms which I just talked about, because sometimes the women just are not aware that they have a problem, or they don't take it so serious. because from my experience, I have a lot of patients who are telling me that their gynecologists just say, well, you have dysmenorrhea, it's normal. And sometimes they also talk about their families, that also their mother or their grandmother already experienced dysmenorrhea. So they just think it's normal to have dysmenorrhea, but actually it is not. The menstrual bleeding should be painless. So this is something you need to talk about with them, and so that they are aware that they have a quite severe disease if they're diagnosed with endometriosis, and that they should do something if signs and symptoms show up.